Oh, everybody, you know what time it is. It's time for another Patients First podcast. And I'm your host, Dr. Bryan Laskin, welcoming you here. I'm excited that you're here. Where today we're talking about how dentistry should, can, and will be more accessible. Getting dentistry to more people vitally need it. But today, our podcast is brought to you by Toothapps Insights. Insights, which brings not just metrics, not just KPIs, not the information that you need to run your business, but the insights in how to make it better. Check it out at toothapps.com. Toothapps Insights. Well, Toothapps Insights is actually a great way of how dentistry is getting cheaper. We're getting way more insights into how we can leverage our practices, automate things, and basically leverage technology to grow our practices. And the technology, oh my gosh, it's getting cheaper. I just went to the California Dental Association meeting last week. It's probably been a while since I recorded this, but I went to this year's California Dental meeting and I saw Shining 3D, which is a new technology startup in the US. I think they're been overseas for a while. But you can buy a printer, a CAD CAM system with a face scanner for $25,000. And we're talking with all the software. And this is not new. We all know technology, most technologies get cheaper with time, and that's happening right now. So Toothapps is another good example where we have integrations where there's only one integration to get access to all of the information that you need versus you might not know it, but if you have five different systems today, if you have a recall system and you have a review platform and you have a paperless forms product and you have a payment system, every single one of those software vendors is probably paying a separate integration fee to the practice management vendor. With Toothapps, no more. There's one integration fee that actually interoperability transaction, such that it's bringing down the cost of software, getting rid of the dent tax. So dentistry, my friends, dentistry is becoming less expensive. At least it's becoming less expensive to deliver care. Now, that's from a technology perspective. Obviously, dentistry is not getting more, getting more efficient to charge. Isn't getting cheaper to deliver from other perspectives. Our employment costs are going up. We've talked about on this podcast. Insurance reimbursements are going down, and which just blows my mind. I don't know how they can get away with that. And our materials costs are going up too. But we should lever what we can to grow our practices, and that, my friends, is technology. It's getting way cheaper as employment costs are going up and people are getting harder to find. Technology costs are going down and technology is able to do much more. But people, in our nature, humans have been around for millions of years, and it is in our nature to look for problems, right? If there's a tiger coming at us and we're wired to look for problems, we're probably going to run out of the way. So we are biologically wired to look for problems. And when it comes to things being expensive, it is a problem. So people look at a dollar amount of something, and rather than looking at the value, we tend to look at how expensive it is. And obviously, that's not the case. If we can spend $1 to save 1,000, we should do that all day long. And magically, when things get less expensive, the problems tend to drift away. And I'm seeing that right now with CAD CAM dentistry. When I was talking not that long ago to dentists about a $150,000 CAD CAM system, the problems mounted. But when it's $25,000, those problems don't seem so big anymore. And so that's my point, my friends, is that the cost of technology is dropping. What used to be expensive no longer is. Case in point with Toothapps, things like reminding patients about their appointments, reviews. There are legacy platforms that are overcharging. I believe they're overcharging. They're providing a dent tax, software dental tax to practices and avoid those platforms, right? But if you're a patient, what does this mean? How can we actually leverage technology to have our dental costs go down, right? Or if you're a practice, how can you leverage these? So we've talked about automation before, and there's many ways, many ways in a dental practice to both increase profitability through things like insights from Toothapps or decrease costs. And what I want to talk today is about the technologies that not just decrease cost, but make dentistry more convenient for everybody. Everybody in dentistry can benefit greatly from some of these from some of these technologies. Why am I passionate about this? Well, we posted online an ad for Toothapps calendar, which means you can look at your calendar at home when you're sitting at home. You can be looking at your son's baseball game right next to your patient schedule, right next to your HIPAA training, all in one mobile view. And a dentist wrote a comment that said, your schedule shouldn't leave the office because dentists work too much already. Okay, okay, let's break this down. Dentists work too much already. Great. Then don't look at it. Have an assistant, have a hygienist, have somebody across the world looking at it. But patients, I hate to tell you, your teeth don't just break during office hours, Monday through Thursday, right? People's teeth break all the time, or they have other things to do. They're working and busy just like everybody else. So at 10 o'clock, my wife might say to me, hey, did you schedule your dental visit? Oh, so I got to pull up my phone and make that visit. And we should have people there. Doesn't need to be you. Have somebody that can field those calls. And even if you don't have somebody all of the time, make it convenient for everyone. So, what are those technologies? Number one, teledentistry. And teledentistry is a marketing term. Let's call it what it is. If you pick up the phone and talk to a dentist, teledentistry. However, we've moved from teledentistry being on the phone to being like a photo or a video. And any dentist can look at a picture of a tooth and 90% of the time have a good idea of the next step, right? Now, you can't diagnose obviously from a photograph or from a video, but you can get a really good idea of what needs to happen, particularly if you follow that up with either securely texting with the patient or having a conversation on the phone. So it's very easy, and frankly, this can happen what's said asynchronously, not at the same time, right? So if you send a photo of a broken tooth to a dentist and it takes them an hour to get back to you, it's usually no big deal. And frankly, it doesn't have to be the dentist. It can be an assistant, it can be somebody else. They can have the Teledentist, which is a wonderful platform where they have dentists who field calls for other dentists, right? So you don't even you can outsource it if you don't want to do it, but at least have it available to your patients, right? Similarly, with post-operative care, if a patient comes in and has a crown done, and then it's sore the next day, right? Well, all patients usually need to hear is that that can be normal, and check to make sure that this is normal post-operative sensitivity, and give people the options of how to take care of themselves, whatever that is that you like to tell people, and then obviously let them know if it doesn't get better in 2 days, come back to see us, or if it gets worse at any time, be sure to follow up, right? Those types of cases where you have discomfort after dental care, being available, having somebody be available, not even you, not even somebody in your office. It could be the teledentist that does this for you. Just being having a resource available for patients. Frankly, I think it's a small s, not a standard of care, but this isn't like a capital S standard. This is a small s standard of care. Also, what about orthodontic follow ups, sleep dentistry, TMD follow ups, people that have jaw pain, following up with them? Usually, most of that is a conversation with the patient that could be done over a secure version of it's like Zoom or Teams, teledentistry, virtual visits. And all of this stuff. Let's talk about the teledentistry where we look at a photo or where we do post-operative care. This takes minutes of time. And just setting up a room in a dental practice and then sterilizing everything costs hundreds of dollars. So my friends, what does this mean? We're reducing the cost of care while we're increasing accessibility. you We can have somebody across the country looking at a photo who's a dentist. Now they're, obviously we have to crossing state lines. There's some legal ramifications. You have to check your state laws if you're a dentist. But from a functional perspective, we can have anybody reviewing these in the office or outside the office that, and it takes minutes to do. So we can do this when it's convenient for us the vast majority of the time. We can do it in minutes versus taking 30 minutes plus driving down to the office, going in and seeing the dentist, and then driving back and going back again when you actually have to have something done. Or sometimes we eliminate visits completely in the case of post-operative care or orthodontic follow-up and sleep dentistry where nothing needs to be done. So what does that mean? It means we're reducing time. We can actually outsource this to people that cost less than the dentists that are doing the care traditionally. And so what that does is it increases accessibility and reduces cost, right? So that's huge. And like with all technology that we talk about at Upgrade Dental, we pass this through the pillars of progress, what we call the cost framework. Cost is an acronym. C is clinical quality, O is observations for patients, S is ROI, and T is team health. And my friends, I won't break it down because it will take too long, but absolutely every single pillar of progress massively improves when we use things like teledentistry, things like integrations and interoperability and analytics and reduce costs for the technology that we have in our practices. So there are ways that we can at the same time increase accessibility, see more people with by doing less and lowering the cost. So increase our profitability while lowering cost. That's what this podcast is all about. I feel like when people think of accessibility to dental care, they think we're compromising. When they think of lowering cost, they think we're compromising. Absolutely not. Not unless we don't change the way we do things, my friends. Technology is the enabler. When we use these teledentistry tools, when we use business analytics, when we use interoperable systems that have open, secure, and less costly ways of getting access to our electronic dental records, we increase clinical quality, we we improve our patients' experiences, our observations by our patients, we increase our ROI immediately, and we make things better for our teams. Those are the four pillars of progress. And so when we check all four boxes with a dramatic hell yes, that's something we should be doing, my friends. So look for technology that enables accessibility, convenience for both dental professionals and dental providers. And we are entering that phase right now. So if you haven't looked at teledentistry recently, if you haven't looked into the interoperability platform, Toothapps, if you haven't looked into remote care and automation that makes dentistry more accessible to everybody and lowers cost, what are you waiting for? If you have questions about how to get started, if you have comments or suggestions, please like, comment, subscribe, and like I said, I love reading people's comments. Keep them coming and keep coming back, where I'll see you right here next week on the Patient First Podcast.